Alright, so my name is Dan Hind. I'm a student physical therapist at Trine University, and today we'll be talking about ICD-10 and functional outcomes for therapy. So ICD stands for International Classification of Disease, and the World Health Organization has been working on these codes for almost a decade. The US was the last modern country to adopt these codes in 2015, and there are approximately 5 times more codes in ICD-10 than there were in ICD-9. And the increase in the number of codes allows for a greater level of specificity when diagnosing patients. Also, if you're covered by HIPAA, you must submit an ICD-10 code in order to receive reimbursement. So just kind of a quick glance at the codes themselves. They're 7 characters long, including numbers and letters. The first 3 are going to indicate the category of the diagnosis. The next 3, the etiology, the location, severity, and then the last is the extension on whether or not it's an initial encounter or a subsequent visit. So the impact on our daily practice, the codes reported are going to inform the payer why we're doing the services we are. It's going to help justify the medical necessity for our services. And if we were to submit the wrong code, it's possible that we could get denied and then not reimbursed for the services we provide. We have to use our own clinical judgment to decide on the diagnosis that best fits what we'll be treating, and we have to make sure we're choosing the most specific code available. So the impact on the physical therapy profession and healthcare as a whole. Like I said before, the increase in codes is going to lead to the more accurate diagnosing of patients, which will in turn lead to the greater opportunity for evidence-based practice, better insight for optimizing grouping and reimbursement processes, and the seamless exchange of data across all healthcare platforms. It's also going to empower those in healthcare to evaluate patient care, support research initiatives, make clinical decisions, and uncover fraud. So we have to kind of look at this ourselves, and if we were ever to manage a practice, how to prevent denials. So 3 ways we can be specific in our coding. We can audit our codes or our staff's codes regularly, and then we can continue the learning and educating process of ourselves and our staff in order to figure out how to report the codes with the updates that'll come. So moving on to G codes and functional limitation reporting. In 2013, the Center for Medicare and Medicaid started requiring providers to report G codes because they wanted to gather information about patients' functional status throughout their episode of care. When submitting a claim form, there are several things that have to be included, and those are another separately payable service, the G code for the functional limitation and its severity modifier, a completion of the units field with 1 unit of services, the corresponding therapy modifier indicating the discipline of the plan of care, GO being occupational, GP physical therapy, and GN speech, and lastly, a nominal charge of 1 cent for each line with the functional limitation G codes. So how it impacts our daily practice is going to be physical therapists must use their clinical judgment in order to determine the severity modifier. So we have to use our interpretation of assessment tools or outcome measures, the objective data that we find, so range of motion, manual muscle tests, things like that, and then our subjective data, so the patient's history, comorbidities, their prior level of function, and their goals that they have as well. And then G code, we have to understand when G codes must be reported, and there's 3 times at the patient's initial evaluation, at a minimum of every 10th visit or reevaluation, and at discharge. So this is a chart of the severity modifiers that we have to use our clinical judgment to decide on. So it's basically just a percent of impairment, 0% meaning fully functional, no issues whatsoever, 100% impaired, opposite. And these will be submitted with each code you have to specify. And then here's the codes themselves, so the current status, projected goal status, and discharge status. And then the kind of categories, so mobility, self-care, and these will be submitted with the severity modifier. So the impact on physical therapy as a profession in healthcare. The goals of G-codes are to establish an evidence-based connection between rehab therapy treatment and patient progress. Also to get a better sense of the Medicare beneficiary population and to evaluate the effectiveness of our therapy services. And then lastly, to help them reform future payment structures. As far as planning with G-codes goes, we can help create a clear, detailed documentation during each patient's episode of care. So we can kind of track that progress and show Medicare the outcomes we're getting in therapy. We can audit our own or our staff's documentation regularly. We can file our claims in a timely manner and stay current on any reporting regulations, requirements, and legislation that may be coming in the future.